Well, I think the worst is over in terms of dealing with the pandemic because we need to shift from emergency response and sometimes a panic response to a well-balanced and a managed way of dealing with the pandemic going into the future. Because we now have the tools that enable us to handle the pandemic much better. So obviously this was not the case 2 years back when the pandemic started. We didn't have the vaccines. The patient management was relatively poor because this was a new disease. The lab testing was a problem. There were shortage of laboratory reagents all over the world. And we were, using these non-pharmaceutical interventions on a large scale for the first time in many parts of the world. So these are now part of what we do on a daily basis. And I like to believe because of that, right, we should really now talk about how best we can manage, the pandemic, whether we have got deadly variants or not, because we can't predict whether the next variant is going to be severe or not.
And speaking of, managing the situation, when we take a look at the fifth wave, do you anticipate that we could have more than just the fifth, especially with winter upon us, and how do we manage ourselves with that?
Well, we are most likely to have the fifth wave, but we can't predict whether it's going to be, mild or moderate or severe. But in all likelihood, based on what we have had so far in terms of several waves, I think the population immunity is much better. So the wave should be or moderate, but then we just need to be prepared. We need to stay vigilant. We are not out of the pandemic, but definitely in terms of our response to the pandemic, we can do much better. We don't need to respond the way we responded, 2 years back.
In terms of the severity that we see, right, with the Omicron variant, we understand it spreads very quickly, but it's not as severe. So with the fifth wave coming, people who have already contracted coronavirus, and you've also got the issue of long COVID, what do you anticipate will happen with the fifth wave? Is there need for concern or not really?
Well, the best we can do to prepare for the fifth wave is to ensure that we get the vaccines, those who are not vaccinated. So we need to be concerned at all times, but we don't really need to manage the pandemic the way we did, 2 years ago. So we have got vaccines. Those who have not yet vaccinated, they should get the vaccine because it's the best way to prepare for the next wave. We keep on, closing the immunity gap or protection in our bodies. And that way, when the fifth wave hits, obviously combined with the natural infection that we have been exposed to in the past 4 waves, we should deal with it much better.
With new variants, being discovered every other time, what does this mean, especially with vaccine hesitancy, right? So you have some people that believe, why should I even get vaccinated? What's the point? How will it then, protect me from a new variant that was recently discovered?
Well, I think Omicron is a very good example because we can see that those who are vaccinated, despite the fact that we have, a highly mutated variant, those who are vaccinated continue to experience not severe disease. They are not hospitalized in huge numbers like those who are not vaccinated, and they are less likely to die. So the benefits of vaccinations are always there. There's no doubt about it. So this should really be a lesson for those who are still hesitant that the vaccines work regardless of the variant that is circulating.
In terms of expiry dates of our vaccines, any idea of where we're sitting with that? A country like Nigeria last year, and Malawi, getting rid of a number of COVID-19 vaccines because they had expired.
Unfortunately, I don't have that information. It's very much information that will be at programmatic level with the National Department of Health. So I haven't had any concern raised by the National Department of Health that they've got a stock that is about to expire. So I hope that our vaccines still have a very good expiry date.
Are we turning the tide where uptake is concerned of vaccines?
Look, we are. It's just that it's like we shouldn't be really concerned about the small group that we call anti-vaxxers who have declared not to take the vaccines because these are not really, big numbers. We are talking here about most probably less than 20% of the South Africans who are anti-vaxxers. So the majority of those who are not yet vaccinated, they belong to the vaccine hesitant or groups. And they can easily be persuaded to get the vaccine. As long as we send a positive message across, they should be able to be persuaded at some point to get the vaccine. So we should continue with positive messaging.
Professor Jeffrey Mphahlele is the Deputy Vice-Chancellor for Research and Innovation at the Northwest University. He's also a member of the Ministerial Advisory Committee on Vaccines. Thank you, sir, for availing yourself this afternoon.